Hello, welcome to my channel. I'm Dr. Shirin, a general physician. Today I want to talk about a very important topic. It means stroke. When the blood supply to the part of the brain is reduced or completely stopped can lead to stroke, and we should know that oxygenated blood doesn't reach to the brain tissue and brain cells going to die. And we should know that stroke is an emergency situation and patients should be taken to hospital immediately. And each second for us is very, very important. Now I want to talk about the type of the stroke. We have two main types. First one is ischemic stroke. 80% of a stroke is ischemic one and can happen because of the blood clots and blood vessels of the brain. And also we should know that blood clot can form in other part of the body and can move toward the brain. And other things can make ischemic stroke, such as cholesterol. Cholesterol can blockage the blood vessels in the brain and can make this type of a stroke. Second type of the stroke is hemorrhagic because of the rupture of the blood vessels due to high blood pressure, use of the anticoagulant medication, and the last things because of aneurysm or bulge in the walls of the blood vessel. All these things can lead to increase the intracranial pressure, and we should know that 50% of the stroke is hemorrhagic one. Let's talk about the TIA or transient ischemic attack. It's a mild type of the stroke or attack can cause due to the interruption or reduction of the blood supply to the brain, and we should know that the symptoms is temporary, but we must pay attention to it. What are the risk factors of the stroke? History of the heart attack or any cardiovascular disease, high blood pressure, high cholesterol, diabetes, smoking, and increasing age and stress. All of these are the risk factors for a stroke. Signs and symptoms of the stroke can include sudden numbness and weakness in the legs or arms, especially in one side of the body. Other things is face dropping, or which is called a Bell's palsy. Other signs and symptoms include vomiting, vertigo, and severe headaches. Difficult to speak, trouble in walking, and loss of the balance, loss of the consciousness, and blurred vision are also symptoms of the stroke. According to CDC, the following symptoms are very important to diagnose of the stroke, and now I want to talk about them. According to CDC, we should attention to this sentence. Be fast. B like balance, it means during a stroke we have a loss of balance. E like eye, it means we have a blurred vision in a stroke. F like face, it means in a stroke we have a dropping of the one side of the face. A like arm, it means we have a weakness in arms. And S like a speech, we have a difficult to speech. And the last one is T, it means time. Time to call 911. Before starting the treatment, doctor must determine the stroke is ischemic or hemorrhagic because the medication of each type of the stroke is different. For example, for ischemic stroke, we can give the patient anticoagulant medication, which is forbidden for hemorrhagic one, because during a hemorrhagic, if we give the patient anticoagulant medication can lead to increase of pressure and increase the bleeding inside of the brain. Okay, let's talk about a medication for ischemic stroke. One of the medication we can give to patient is aspirin for first line of the treatment. It's an anticoagulant medication and used for the ischemic stroke. Next one is injection of the TPA or tissue plasmogenic activators, and this drug can use for ischemic stroke caused by a blood clot. Another medication is warfarin, which is anticoagulant medication. Beside the medication, there is a surgical treatment such as mechanical thrombectomy. In this procedure, the doctor uses specific equipment and also catheter to remove a blood clot from the blood vessels in the brain. Let's go to talk about a medication which is used for treatment of the hemorrhagic stroke. The aim of this type of the treatment for hemorrhagic stroke for reduce a blood pressure and also reduce an intracranial pressure and stop the bleeding. One of the important medication for hemorrhagic stroke is calcium channel blockers such as nicardipine. Other medication is beta blockers such as labetalol. For severe hemorrhage and bleeding, the best option is surgery, such as embolization, clipping, and also angioplasty. And finally, I want to talk about the prevention of stroke. One of the important prevention ways is having a daily physical activity. Others is eating a healthy food, and also don't smoke, reduce alcohol consumption, and also control your blood sugar and blood pressure. Thanks for watching this video till the end. I hope you enjoyed. If you like it, please subscribe to my channel. See you in next video.